Hi, Twin City Health family. Dr. Megan here. I am going to be talking about anxiety, who it affects, what happens in the brain and body, as well as some tools that we can use to hopefully help. First of all, this is a very common experience. It is very high in adults between the ages of mid-20s to mid-40s. There's so much going on during that time of life that we have to figure out, people to take care of, and it can feel very overwhelming. And unfortunately, anxiety can feel quite isolating. So if this is you, just know that you are not alone. There are so many of you who are experiencing it. You voted for it. That's why we're talking about it. So you are absolutely not alone. And secondly, anxiety is intense. It can be debilitating. It robs us from the present moment. It robs us from truth and acceptance that we're not in control. Anxiety makes us feel like a failure, like a weakness that we should be able to overcome. But unfortunately, most of us respond by trying to control it, by isolating until it calms down and we feel more in control. But the problem is that the more we try to control it, the more aware and overwhelmed we feel by the uncontrollable, which makes us feel more weak, and it can feel extremely difficult to ask for help. Chip Dodd refers to anxiety as impaired fear. We learn to fear the anticipation of what could happen, not even what's inevitably going to happen, but what could be, and start practicing obsessing over trying to control the future. And the truth is that we are ultimately not in control, and sometimes we do need help. So symptoms of anxiety include increased heart rate, sweating, muscle pain, aches, difficulty breathing, stomach aches, actually getting sick, like flu-like symptoms, pins and needles, difficulty sleeping. And these extreme responses happen because when anxiety hits, there is a disruption in the emotional center of the brain, which triggers a response to threat. Whether that situation is actually life-threatening or not, that part of the brain has a hard time deciphering, and our body ends up responding the same way, like we are about to fight for our life. So symptoms can be really, really intense. And the good thing is that there are things that we can do to help bring those symptoms during the experience down. And there are things that we can do over time to help lessen the length of those experiences. So acronym I came up with is DGPR, and that stands for Dear God, Please Restore, because that is usually what we're asking for in those moments that are so intense. We feel desperate and we just want restoration. But the letters stand for distract, get safe, process and ask for help, and then release. So distracting our brain from the present experience and giving it time to realize that we're okay. And then we can go through the next steps. So this could look like keeping something sensory oriented at your desk, in your pocket, something squishy, something smooth. Maybe it's a candy to suck on, maybe it's sour, maybe it's a lollipop, but distracting your brain from what you're worrying about and then telling your body it's safe. We can do this through actually getting chiropractic adjustments if you have the availability that day, breathing techniques, tapping techniques, and then the P is process, ask for help. A lot of times this is when we really need to recruit someone else to help us get through to the next step. So processing could look like journaling, processing with ourselves, talking to someone else, processing with someone else, and then praying, asking for divine perspective, divine intervention, and then finally releasing. This could look like movement, extreme temperatures like heat or ice, different body therapies, massage, going outside, screaming, crying, even smiling can help tell our brain that we are safe and can move on from this experience. some other more long-term practices to help us go through these steps more quickly would be getting in more movement throughout our days and weeks, cutting down on alcohol and cutting down on processed foods, caffeine. Those are things that can really ignite the things that anxious people already feel heightened experiences of. And then adding in good stuff, getting in more supplements that support our hormones and adrenal glands, like vitamin D3, adaptogens, getting more sunshine, and of course, learning more coping skills. If you can connect with a cognitive behavioral therapist, that's the easiest way to get coping skills. But the reality is that we can't delete all of these stressors in our life. We are going to be met with chaos, and that is how our body learns. So it's a good thing. We just need to learn how to move through these steps quicker so that we can process and release the stress quicker, so that it is not controlling our lives. And last final reminder, I just want you to know that you, again, are not alone. And it might feel limiting now, but it should feel freeing at some point, that you're not in control, and so you don't have to be.